the gallbladder is what is it stores or where's oh my gosh, I always forget which one stores and produces the bile. Um, is it
It
stored in the gallbladder?
does it stores the bile. It's
Stores the
it
bile.
doesn't
Yeah.
yeah. What does the pancreas do then? Yeah, it
Pancreas
stores
releases and stores in the bile or in the gallbladder.
yeah, I think so.
Something.
We're gonna take this part out.
Oh my god.
Hello there, welcome back to The Bleeding Truth. My name's Sally McNally, and usually I say, and this is my daughter Bridget, but Bridget can't be with us today, but she sends her love to all of our friends. So today I'm really lucky. I have another strong woman with me, and her name is Brittany Fowler. Brittany is a nutritionist, and I want Brittany to come with us today to discuss all things nutrition for women and with the focus, of course, on pregnancy. Welcome, Brittany. How are you?
I'm doing well. Thanks so much for having me, Sally. I'm honored to be here.
You're you're welcome. I'm happy you're here. Tell us a wee bit about yourself.
Yeah, so I'm a registered dietitian at a private practice in Camarillo called 360 Nutrition Consulting. So we see lots of different types of clients for all sorts of metabolic disorders like diabetes, also all sorts of heart disease parameters. Also, I see a lot of gastrointestinal clients, and then prenatal and lactation. Those are kind of my two main specialties there.
That's really important for our patients to have somebody that we can send, an expert on this kind of subject. But go on, tell us what led you to this nutrition.
Yeah, so kind of my own health journey. I had quite a bit of gut issues growing up, stemming from when I was pretty much a child through my teen years. And that was also at a time when I had personally struggled with some disordered eating patterns, which, I was a ballet dancer in my history. So unfortunately, that is pretty common in that population. So kind of all those things combined led me to discover personally what nutrition can do in the body, not only for healing, but also just for, feeling and being your best. So when I found out that you can do that as a career, I was like, yeah, sign me up. So
That's so wonderful. Yeah. And to have that kind of history makes it more personal and more important for you then to share what you've learned. Yeah. Thank you so much for following this path. It's so important, isn't it?
Yeah, I'm definitely passionate about it.
Yeah. Yeah. Well, I have so many questions. Um, I wonder, could you maybe just talk to us a little bit, whatever way you want to share the information? I know you might have some slides which are really interesting. I'd love to see them. But I wonder, could you maybe start talking about pregnancy? Tell me a little bit about the nutrition that women need in pregnancy.
Perfect. Yeah. And per our prior conversation, I jotted down some notes on some of the conditions that you wanted me to hit on as well. So I figured we could kind of start, yeah, with general prenatal nutrition, which, as we kind of talked about, I look at really as general nutrition. A few extra considerations that are specific to the pregnancy period. But really, all the background stuff is the same that we'd recommend just for the general population as well. And then also, we'll talk about some supplements to consider during pregnancy and lactation. And then so special considerations during if someone is experiencing any of those conditions, so gestational diabetes, hyperemesis gravidarum, you had mentioned obesity, anorexia, gastric sleeve, and then lastly we'll go into lactation nutrition, which is very, very similar to prenatal, again, just with a couple nuances that are specific to lactation. Um,
Fabulous.
yeah, so starting with just general prenatal nutrition. So, let me try to share my screen here for those who are watching and not only listening. So, we call this the balanced meal formula. Three boxes on the top there. We have carbs, proteins, and fats. So, those are what we call our macronutrients. So, the three main things that make up our food in different amounts. Carbs, we break down into glucose. So that's our body's primary and preferred source of energy in the body. That's what our cells, our brain, our muscle cells use for energy. Some common sources of carbohydrates include breads, pasta, rice, quinoa, oats, tortillas, all of our starchy vegetables. So things like potatoes, sweet potatoes, certain squashes like acorn and butternut squash, pumpkin, parsnips, green peas, corn, and then all of our fruits. That would be carbohydrates. So, proteins we need for rebuilding muscles and tissues. And in the case of pregnancy, building muscles and tissues. Creating a human is a lot of work.
Yeah.
uh, Pretty darn amazing, if I must say. Um, and so,
Women are powerful.
oh my gosh, yeah. It's amazing. And we can get protein from both animal and plant sources. So our animal sources would be, like chicken, turkey, beef, pork, fish and seafood, also eggs, dairy. And then our plant sources would be things like nuts and seeds, nut butters, beans and lentils, all of our soy products, and then protein powders as well. And then we have fats. So we need those for lots of different things in the body. So brain health and especially fetal brain health as well, creating a brain. And also, cellular function, skin health, eye health, lots of different things. And some sources of fat in the diet include all of our oils. So, for example, like olive oil, coconut oil, avocado oil, butter, ghee, nuts and seeds, and then also our fatty fish. So, not a comprehensive list, but those are just some of the main places that we see those things.
So I sometimes get patients telling me, "Oh, I don't want to eat eggs because there's too much fat or there's too much cholesterol." Uh,
Yeah,
I'm looking. Do I see eggs on that list? The
they are
eggs.
on the list. Yes.
Yes.
It's kind of joked about a little bit in the nutrition world. It's like, what is it today with eggs? Are they
Yeah.
good?
Right.
I feel like out of anything in the nutrition world, that's always kind of changing. Um,
Yeah.
so with eggs, and by the way, we'll talk in a little bit of like more specifics kind of in those
Mm,
categories of like more nutritious, less nutritious options. But
yeah.
yeah, with eggs, definitely they're a great source of bioavailable vitamins and minerals like choline, B12, lots of different things that are very beneficial for the body. If we want to err on the side of caution, basically, what the current research says is one egg yolk per day actually seems to be protective against heart
Mm,
disease. Kind of like, and this might come as a surprise to many people out there, maybe not, but there's actually a substantial amount of research also to show the benefits of full fat dairy if someone is consuming dairy. Um, and I think that makes a lot of sense when we get a little further into kind of balancing those meals and snacks and why that might be the case. So yeah,
yeah.
eggs absolutely can have their place in a balanced, healthy diet. We usually say at our practice, like, 2 egg yolks a day. And if you want more protein, throw in some egg whites. It's just 100% egg whites. But yeah, if we want to be super cautious, 1 egg yolk a day. So down below, we have this other box, non-starchy veggies. So those are mostly made up of fiber, water, vitamins, minerals, antioxidants, all things that are great for us. However, they don't really have digestible carbohydrates, so we're not really getting glucose from them. So we don't want to count them as our carbohydrates. We want them in addition to. As I mentioned, all these things do different things in the body, different functions. But what we're looking at here, and this is kind of jumping ahead for a moment, extra important if someone has gestational diabetes, but also
Mhm.
important, if they don't. We want to try to have those things together. So when we're eating, we want to try to pair our carbs with our proteins and fats. And that's because if we just have carbohydrates, so let's say for breakfast, someone's just having, I don't know, a toaster waffle by itself, or maybe some instant oatmeal or some, toast with jam. When we're just getting carbohydrates, we digest carbohydrates the most quickly. So we digest them, turn them into glucose, and we get a spike and then a crash in our blood sugar. And especially for gestational diabetes, we want to try to avoid both those spikes and the crashes. We want to stabilize blood sugar. So on the flip side, let's say we just had maybe some eggs for breakfast, like you were mentioning. Eggs are great, but if we just have eggs, we're not getting carbs from them. We're just getting protein and fat. So we'll feel physically full, but our cells are missing out on that glucose. And a couple different things can happen. Oftentimes we'll see some kind of residual cravings happen, like for some quick energy, quick carbohydrate foods like, sugars or processed carbohydrates, something that'll give you a quick spike in energy. And sometimes we may not feel that, but our body is actually breaking down our muscle protein to turn it into glucose to protect itself from low blood sugar. So when we have them together, so let's
Mhm.
say, for example, eggs with toast or like an apple with peanut butter, we're getting the carbohydrates that our body needs, but the protein and fat helps us to digest them more slowly because we're digesting the whole thing more slowly now.
Okay.
So instead of a spike and a crash in blood sugar, we get a more gradual rise, which should happen after we eat, and then a more gradual fall, so more stable blood sugar.
That's really interesting. But I was just wondering, so if we pair the carbs and the proteins, do we also throw in a wee bit of fat
Yes, definitely. So
at
most
the
and sorry,
same?
I said that too. So most of our proteins, especially those animal proteins, come along with fats and also our nuts and seeds. Those are
Okay.
counting for both protein and fat. Uh, so I can only share one screen at a time, but there's one other screen that I'll jump to in a moment. This is just a visual of what that balanced meal formula could look like. So when we look at this, and for those who are not looking at the video, I'm going to explain here what we're looking at. Um, when we look at this, we're not talking about portion sizes. That's going to be very individualized. We're talking about the ratio or the proportion of those things to each other. So ideally, we want to have, when we're eating, we want to have about a quarter of what we're eating carbohydrates, quarter of what we're eating protein, half of what we're eating non-starchy veggies whenever we can. And then fat is in there in the middle just as a reminder to include it. Make sure that it's in there somewhere. So like you were just pointing out, Sally, a lot of our proteins come with fat, so we won't always see it, or oftentimes we won't see it on the plate. But just a reminder to make sure that it's in there, or like the oils we're cooking with, dressings that we're using, things like that. Because yeah, absolutely, we do want both protein and fat. Mhm.
Okay, I like that. She has a picture of the plate and a quarter carbs, a quarter protein, and a half non-starchy veggies. Yes.
Yeah,
Making me hungry.
I know.
Now she has beautiful pictures of food.
Yes, yes. And I want to point out too for anyone watching, like this can look so many different ways. It does not, of course, have to be different spots in your plate like that. This could be a burrito and that could be perfectly balanced, or it could be, all in a casserole. That's just in theory, if we were to pick it all apart, kind of that ratio that we're looking at to really meet our body's needs. And I just want to point out before I stop sharing this as well. Let's say, like, for example, apple and peanut butter. I use that example. We don't have veggies in there, and that is okay. We still want to focus on that left side of the plate, making sure that we have that carb, protein, fat combination, again, to help with the blood sugar.
Well, now all of this is general nutrition, right? Just for anybody, whether you're pregnant or not. And of course, we're talking about women's health, or everyone's health in general. So this is really interesting. I'm learning a lot here.
Good, good.
So, so go on ahead, keep going. Tell me more.
Yeah, and that's a good segue. So like I said, the basics of prenatal nutrition are the basics of general nutrition. In a bit, we'll get to, foods that should be avoided just for safety during pregnancy, but, let's just take this a layer actually, before we do, let's touch on gestational diabetes for a moment, because that's something I feel like a lot of my clients come to me either with gestational diabetes or type 2, and they're, maybe they've been told to cut carbs or, one thing or another, but they don't quite understand what that diabetes actually is. So, um, for those who aren't super familiar, basically it's insulin resistance. I know you know all about this, Sally. So the way that I like to think of that is, so optimal functioning individual, right? We eat something with carbohydrates, our blood sugar rises, and then our pancreas releases insulin, which is like a key that unlocks your cells to let the glucose in to be used for energy. With insulin resistance, which that's what gestational diabetes is, also what type 2 diabetes is. What happens there is your pancreas is releasing that insulin, but it's kind of like the lock was changed and the insulin is not working to let the glucose into the cell. So, two core things that we want to work on with gestational diabetes, which again is important for anyone, but extra
Yeah.
important for that population is number one, balancing that blood sugar, like we were talking about, because it's much easier for the body to process releasing smaller amounts of insulin over a longer amount of time than it is to crank out a whole bunch of insulin at once to try to let all that glucose into the cells. So on that basic level, just by, that balance when we're eating, pairing those carbs with the proteins and fats, that can really do a lot. And then also when and how often we're eating, which we can get to in a little bit. Um, certain times of day we're more insulin sensitive. And so that's what we want is that insulin sensitivity. So I know so much of this we could go on for so long, but
Well, well, no, yeah. Thanks for talking about the gestational diabetes because when we think of nutrition in pregnancy, that's one of the big ones. Um, where we look for diabetes around 25, 26 weeks, we test our women with a 1 hour glucose screen, and then if that comes back high, we do a 3 hour glucose screen.
yep.
And none of the women like it. But we're always so happy when we find a diabetic in pregnancy. And because if you have diabetes in pregnancy, you're more likely to have other problems, like the
Mm,
blood pressure can go up. Your
yeah.
baby can get too fat. It's not so much that the baby gets like big boned, but
Mm,
their whole body can get really fat because the sugar finds its way in there.
yeah.
And then the neck and shoulders can be like a little rugby player.
Yeah.
Um, and then that can be hard to push out, and the baby then is in danger of
Mhm.
getting stuck. So yeah, there's
Right.
a few things that we worry about, but they're the two biggies. Yeah.
Definitely. That's a good reminder. I have to get I'm 25 weeks now, so I need to get my oral glucose test done next,
Yes.
things next year.
Disclosure: our Brittany is pregnant
Yes.
again for her second time.
Yep.
Uh, so so all of this is so personal and so important for you and for all the other pregnant women listening to this.
Yeah.
So keep going, keep going. Tell us more.
Yeah, so let's jump over, last time I'm gonna share my screen. We'll jump back to that original balanced meal formula. Keeping in mind, like, at our practice, we have the luxury of being able to work with clients over the long term. So we put this into practice together. We kind of take it little by little. I'm kind of moving a little bit quickly and covering just the basics for today. But just to take it one layer deeper, into a look at some choices that are kind of more nutritious for the body, less nutritious for the body in each of those categories. And therefore, better for blood sugar and things like that. With our carbohydrates, we want to pay attention to choosing higher quality, what we call complex carbohydrates, so high fiber choices. And that's because fiber, just like protein and fat, fiber helps to slow that absorption of those carbs into the bloodstream, so stabilizing blood sugar. And fiber also makes us feel more full and satisfied. So we tend to actually consume less of those carbohydrates as well. So
Uh,
those choices would include all of our whole grains, so like whole grain bread, whole wheat pasta, brown rice, quinoa, oats, whole grain tortillas, all of our starchy vegetables, especially with the skin on, because that's where a lot of the fiber is, and then all of our fruits. And in case anyone out there is wondering, yes, you can have fruit. Fruit is awesome for you. We just want to make sure that we are consuming it as a part of a balanced meal with some protein. And basically, the overall theme here is the less processed, the better for us. So that's what we're looking at with the carbohydrates. The less processed options are those higher fiber options. Same with protein. So we want to choose, the whole protein sources whenever possible. So things like, the actual animal protein, like the chicken, the turkey, the fish, the seafood, eggs, also like our nuts and seeds, things like that. And just trying to limit, not avoid, but limit those processed meats. So things like sausage, bacon, things like that. Lots of reasons, but just generally a bit inflammatory, not great for us. So minimally processed, the better. And I always encourage my clients, like, buy the highest quality that you can comfortably afford. So we never want to break the bank on anything, but if you can swing it and buy things like, grass-fed beef, grass-fed dairy, go for it, but don't also worry about it. If you cannot, that's okay.
Can I just add a little note there? Um, also to chew the food well, right?
Yeah.
That, sometimes well, I know I see my husband, he just, like, eats really quick. I don't know if he gets to chew it or even taste it, it goes down so quick. But especially pregnant women, if they get good quality food and chew, 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 and get all the nutrition out and send it like an energy flow down to their baby.
Absolutely, yeah, and being relaxed while eating and focused on eating as well. Yeah, I'm so glad you brought that up too. Lastly there, I was gonna say fats, same thing, less processed, better for us. So, as far as oils go, stick in as much as possible to like extra virgin olive oil, unrefined coconut oil, avocado oil for any high heat cooking, grass-fed butter when that's available, especially like that Kerrygold Irish butter. Oh my gosh, it tastes so much
Happy
better.
cows. Happy, happy cows.
Happy cows, yes, I love that. And then all of our nuts and seeds, fatty fish, those are all great sources of fat. Really the ones that we just wanna limit are those inflammatory seed oils, which are just very highly processed. So anything like canola oil, all those vegetable oils, so things like, soybean oil, rapeseed oil, cottonseed, there's a list of them. We're not going to avoid them in the diet, that would be unrealistic in my opinion completely, but, just limiting them and choosing, cooking with those oils at home whenever we can. Mhm.
Yes,
And
very
then all of
good.
our veggies and fruits are great, nothing to touch on there.
It sounds amazing, but I know that a lot of women have to work,
Mhm.
and work long hours, and they may not have time to come home and put a well-balanced meal together.
Uh-huh.
Um, so what kind of advice could you give them? Where should they go to get, like, fast food? What fast food might be healthy?
Mhm. Yeah, I'm so glad you brought that up, and that's something I love working with people over the long term on is I'm not one of those people that likes to say, "Eat these foods, here's a meal plan." Because who's to say that that fits in their cultural background and they like those foods and it works with their lifestyle. So that's something that we often do quite a lot in our appointments actually is that meal planning and,
Oh, yeah.
coming up with ideas and stuff. Um there are some so in answer to your question, there are some, restaurants and kind of more fast food options that have healthier options. One that comes to mind is like Sharky's. They have certain options like brown rice and whole grain tortillas. They actually have grass-fed beef and wild salmon, which is super rare for that sort of a chain. Um,
Shout out to Sharkies, good on them.
Sharky's.
I think of Chipotle.
Oh,
Chip
yeah, and Chipotle as
Yeah,
well, yeah.
yeah.
Yeah, so
So
certain
if you're
places that
not
make it
from America and you're listening to it, these are like American fast food places that that people who are vegetarian usually like too.
Yeah, yeah, and they just have more nutritious options there, now as far as eating out goes, like, that balance that we're talking about, that can be applied at home or out, so on that basic level, do I have a carb, protein, and fat in that meal? Can I throw in some veggies? Um, Not that salads are the best by any means, but, side salads can often be a helpful way when you're eating out to incorporate those veggies because cooked veggies aren't always an available option. But I also like to work with people on things that are easy and quick to make at home. So, like sheet pan meals, a lot of people have heard that term out there. So basically, things that you can cook all in one pan, just throw in the oven.
Okay.
Um,
What
those
was that called? Sheep pan?
sheet pan meals. So yeah, like things you can make on a sheet pan. uh,
Okay.
Cook at the same time. So just for example, like, for someone who's consuming meat, for example, having, like a package of chicken breast tenders, like the small kind of chicken breast, pieces, a thing of baby potatoes and some maybe already chopped broccoli, tossing everything into extra virgin olive oil, seasonings of choice, and then lay it all in the pan, put it in the oven. So the prep for that would take about 5 minutes. Cooking time, maybe 25 minutes depending on temperature, but you can be doing other things while it's cooking, which is nice too. So, um, absolutely. And I'm a working mom of a 2-year-old pregnant working mom, which, you know, time is absolutely a concern. So I'm all for quick and easy, healthy, balanced
And
meals.
and you made that sound super easy. Um, recently my husband has been cooking with an air fryer. What do you think about the air fryer?
What's funny is, my husband, Zach, and I, we were looking into air fryers because I feel like we're the only ones in America that don't have air fryers. So, we're looking into that for Christmas this year for ourselves, but to my knowledge, they can be great, and you can probably tell me more about your air fryer than I
It
even know
just
about
seems
them.
like really quick and less oil needed and yeah, just super quick. I think that's the best part.
Mm,
But you can't really make a big meal. They're not that big, the air fryers. They're kind of like small. But
yeah.
it's it's a good option, I think.
Yeah, what I think of is because 'cause I'm big okay, time constraints, I'm glad you brought that up because 'cause I'm a huge believer in, cooking extra and then have that for
Oh,
leftovers.
good.
If you're a
Yeah.
person that's cool with leftovers, because then, like, people often will say, like, "What should I eat for lunch?" And I'm like, "Why are you making a separate lunch?" Just, make more dinner and heat it up for lunch. I know different people have different,
Yes.
taste preferences and everything. Some people are more for leftovers than others, and that's totally fine and good. But that's one downside I see to air fryers, but what I see as a plus, at least for our lifestyle, is if we were making something like a pasta dish, like, maybe with a,
Yeah.
ground meat kinda sauce, like, everything's on the stove, but then if I want some roasted broccoli, I don't wanna heat up the whole oven, so I can see the draw
Yeah.
of fire for
True. Yeah.
that.
Uh-huh.
Yeah.
Yeah. So Brittany, to go back to pregnancy, is there anything else you want to tell us about diabetes in pregnancy? Anything else we should focus on?
So, yeah, a couple other things, and I'll move quickly. I know there's so much of this we could spend so much time talking about.
It's
So
so interesting. I love it.
yeah, me too. So let's talk just for a moment about meal timing. So I always want to place the biggest emphasis on, making sure we're nourishing the body. So this is by no means coming from a place of restriction, but really more nourishment and balancing those blood sugars, supporting our metabolism. So
Yeah.
super important for gestational diabetes, but also in general. So couple general points, and then I'll give you an example. This is also something I definitely work with clients individually on to see what would work for them and their lifestyles. But couple points that research shows benefits to. One would be eating about every 3 to 4 hours during the day. We want to try to eat within about 1 to 2 hours of waking up in the morning. That helps to get our blood sugar, kind of stable for the day, set us up for stable blood sugar, and then also helps to get our metabolism going for the day. And then, if possible, we want to try for about a 14-hour fast from dinner to breakfast, minimum of 12. And that helps for a lot of reasons. We could go on a long time for that. But really, we want the gut to be able to clean itself out, and have that, that fasting window overnight. And really relating that back to the diabetes part of it. I briefly mentioned, I think, a little bit earlier that during the daylight hours, we're much more sensitive to insulin. So when we're in our activity phase, for those of you who have heard of circadian rhythm, um, we want to eat during our activity phase. So when the sun is up, and then when the sun is down, our body would like to be fasting. And that's kind of the body's prime time to do all of its housekeeping kind of stuff, repair and healing and all of that stuff. We want to align our eating with our circadian rhythm, put simply. So basically, we want to eat when the sun is up, fast when the sun is down, if at all possible. And that's because, well, lots of reasons, but especially for blood sugar. During the daylight hours, our cells are meant to be opening up, taking in that glucose, and our gut is also meant to be digesting and absorbing. In the nighttime hours, we're meant to be in our resting phase. So the cells are not meant to be opening up, taking in glucose. So we have more insulin resistance, which is what that diabetes is in the nighttime hours. And also, our gut is not meant to be digesting at that time as well. So, if we were to have the same meal, say at 9 a.m. versus 9 p.m., our body is much better able to not only digest the meal at 9 a.m., but also to process those carbohydrates. Um, and so, just an example of what that could look like. So, fasting from dinner to breakfast, ideally for, 12 to 14 hours. eating within 1 to 2 hours of waking, and eating every 3 to 4 hours during the day. Just an example would be, let's say, breakfast around 8:30 in the morning, lunch around noon, balanced snack around 3, dinner around 6, and then being done for the day. And again, totally want to emphasize, like, by no means are we restricting in any way here. We want to make sure that we're nourishing the body during the day and really getting all of our needs met so that we hopefully don't need to be eating at night. That makes sense?
Yeah, very good. Yeah, yeah.
Yep.
And so that's still a focus just on everybody, right? That's for everybody, not just a pregnant person, but
That's right.
especially with the pregnant person.
Yeah, I
They
think
should not fast.
well, we don't want to, like, I don't like to look at it as fasting. I like to look at it more as, eating during the day and then allowing the body that rest at night. So we want to make sure that we're meeting our needs during the day so that we don't have to be eating during those nighttime hours when we're more insulin resistant. So
Yeah.
yeah, exactly. For the general population, but especially for the pregnant person that has gestational diabetes, because that plays a role in our blood sugar as well. So
Right.
and yeah, having those regular intervals of eating as well, because we don't wanna go too long during the day without eating, because that's when the
Mm.
blood sugar can drop and then spike and not
Yes.
not great. Yeah.
Yes, very good. So then, the other thing that pops up a lot for us is nausea and vomiting in early pregnancy. And sometimes, of course, we meet women who have hyperemesis gravidarum, which is excessive vomiting
Yeah.
in early pregnancy. And sometimes that goes on throughout the whole pregnancy. So
Yes.
that's very sad. It's
Mhm.
awful when that happens. When we get a lady like that, we have to send her to the hospital to get IV fluids and IV multivitamins, um, and of course medicine to stop the vomiting.
Right.
So um, hopefully we wouldn't have to send somebody with a really bad case of hyperemesis to you,
Mhm.
but I'm sure you come across women with just regular nausea and vomiting.
I do.
Also, please give me advice for the other ladies who have the excessive vomiting.
Yeah, and you're right, in the extreme cases, often they would be, under more strict supervision, they'd be going to the hospital. I have had a couple of client cases with hyperemesis, and really the focus well, we wanna eat what's tolerated, number 1, so
Yeah.
I mean, I always explain to my clients of any kind, we're never looking for perfection. In this population, absolutely, we are not looking for perfection. Uh,
Yeah.
wanna prioritize fluids and electrolytes, and then really, carbs and protein tend to be better tolerated. One snack just in practice, there's nothing, like, magical about this food, but one thing in practice that I've seen, patients with hyperemesis or HG tolerate pretty well is something like a banana and peanut butter because it's high in electrolytes. It's a great source of carbohydrates and that sugar, the energy for the body. But we also have some protein and fat from the peanut butter, or like even toast with peanut butter and banana. That can be one that's kind of more tolerated. But yeah, huge emphasis on hydration, electrolyte replenishment. I would recommend a liquid multivitamin also for that population. Like Mary Ruth's has a good prenatal liquid that tends to be
Mary Ru
easier than swallowing. Mhm.
Okay. Mary Ruth. Okay, I must remember that for my patients. Anything else about nausea and vomiting? I'm sure you got some good ideas for us.
As far as the nausea and vomiting, I mean, as far as nutrition goes, eating small frequent meals always tends to be helpful. So even more frequent than that 3 to 4 hours like we were talking about with general
Yeah.
population, eating every even 1 to 2 hours, just getting something in can be helpful. Certain herbs like ginger and peppermint, depending on the person, some might find one or the other more helpful. Acupuncture, acupressure, aromatherapy, like there's a lot of other, kind of more functional approaches that people can take with that as well to help. Um,
Yeah.
and then supplements for that, I know we didn't really talk yet about supplements, but for the, HT population, thiamine is typically so when a person's home from the hospital and just kind of maintaining in a sense, uh,
Yeah.
we wanna be supplementing with both B6 and thiamine, so both at about 50 milligrams about 3 times a day is what's generally recommended, as well as that prenatal, liquid if possible.
Okay, great. Yeah,
Yeah.
I had been telling them 25 milligrams, so yeah, thank you. I'll
Oh,
tell
yeah.
them
Well,
a little
25
more.
would be great for, like, general nausea, but for HG, what I've seen out there is more like fixed.
Yes, if they're vomiting. Okay, great.
Yeah.
Um, so yeah, of course, and then if it's excessive, then they're going to need IV fluids and some Zofran. Yeah, great.
Yeah.
And then what about other problems that might show up in pregnancy? Sometimes I meet a woman and she has gallstones. Um,
Oh, yeah. Yeah, I mean, oh my gosh, there's so many things I can imagine that would pop
Mm.
up. Um, I mean, with gallstones specifically, I would look at it as it's really tolerance. So, we would just wanna cut back a bit on, like, fatty foods, like foods that are really
yeah.
high in fat and, like, deep fried foods, things like that.
I have recently had a few patients with ulcerative colitis and
Yeah.
irritable bowel, and some of them are on medications that are not that safe in pregnancy. So we try to wean them, but then their bowel starts acting up. Um,
Mhm.
and these are the patients that I really want to send to somebody like you
Yeah.
that could spend all the time that's needed to discuss the type of foods they shouldn't eat and should eat. And yeah,
Yeah, and that's yeah, absolutely, and there's so much that we could talk about there, but I'd say the super short version there, really all the same general principles we just talked about, and with
yeah.
so ulcerative colitis or Crohn's
Mhm.
even, both that inflammatory bowel disease, um, inflammation is the big thing there. So there's a ton that we could talk about for just generally supporting gut health that we won't have time for today. But extra important with someone who's struggling with either of those things to be really eating those anti-inflammatory foods. So, fruits, vegetables, whole grains, lean meats, nuts and seeds, all of those, minimally processed, healthy fats like the extra virgin olive oil, fatty fish, things like that. Um, and then limiting those inflammatory foods. So things like added sugars, processed refined carbohydrates, and all those inflammatory oils that we talked about. Those are kind of
Yeah,
the big things for
yeah.
inflammation.
Anemia. Everyone's anemic.
Yeah,
And
yeah,
of course it's a thing that happens in pregnancy because we get like about half the amount of blood supply that we already have when we're pregnant. We get an extra half, and that new half is more dilute, so it's diluting everything.
yeah.
Um,
The body's crazy.
so yeah, so sources of iron. What sources of iron should women get other than having to take iron supplements?
Yeah, that's a great question and great segue into we didn't talk about supplements yet. So that's a good segue into that conversation too. So as far as food sources though of iron, so we have heme, Heme iron, and then non-heme iron. So heme iron comes from our animal sources. So, you know, meats basically. Also like eggs. Um, and then non-heme is from plant sources. So things like beans, for example, or even like our dark green leafy vegetables have a lot of iron. And it's the non-heme version. So it's great if we can get both. The heme iron is much more bioavailable. I want to say it's around 80% of the heme iron that our body can absorb, whereas, and don't quote me on this, might be more like 20% of the non-heme. It's much less bioavailable. So even milligram for milligram, we're absorbing a lot less of those non-heme sources. One thing that we can do to enhance that iron absorption is pairing them with foods that are high in vitamin C. So, for example, let's say steak dinner. And if it can be grass fed, there's a little more iron in it. But if not, that's totally fine. So let's say we were gonna have like steak and potatoes. Broccoli would be a good veggie to have with that because broccoli is really high in vitamin C. And so vitamin C helps you
Oh,
to absorb more of that iron. We also want to keep calcium rich foods away from iron, about 2 hours away from iron if we can, because that inhibits iron absorption. Um, so those are kinda main food sources there. As far as supplements go, oftentimes supplements are necessary when levels are just so low or we need a little extra support in the body. So I actually like to start with, a beef organ supplement. So There are a couple of options out there, and I can link in the show notes as well, for grass-fed beef organ supplements. And what I like about those, most I shouldn't say all, yeah, most people aren't consuming a lot of organ meat. And so it's great whenever we can get our nutrition from foods rather than from supplements, because our body absorbs them a lot better and things are generally more in balance than if we were to take a high dose of a single vitamin or mineral that's in its more synthetic form. So beef organs can be a really, really great source of that bioavailable heme iron. And it's also a great source of things like copper and vitamin A that help you to absorb the iron. So I like to start there with that population if they're kind of borderline anemic. Um, and then moving towards prenatal vitamins, which we didn't talk about yet. So that would be something that's recommended, general across the board. And within that, we want to try to choose one that has what's called chelated iron. So that would look like iron bisglycinate or ferrous bisglycinate. And that's because that's the most highly absorbable form from a supplement, and with also the least GI side effects like constipation, which is already a thing in pregnancy. So
Yeah.
anything we can do to help, prevent that from happening is helpful.
If my patients are anemic, I try to tell them what foods to eat, but also I'll advise them to take an iron supplement.
Mhm.
And of course, the ferrous sulfate is a good one, but it can constipate them. So there is a liquid iron called Floridex, and
Mm,
that doesn't constipate them. So that would be an option. But of course, it's a little more expensive than the pill supplement. But tell us more about iron supplements.
so recent research has shown that ferrous bisglycinate is, again, because it's more highly absorbable than the ferrous sulfate has always been, the kind of the go-to iron
Yeah.
supplement. But like you said, it is binding, constipating. And so if we can achieve the same level of that, the hemoglobin hematocrit going up with less iron and less of that risk for constipation, the better. So I want to say, it was 25 milligrams of the ferrous bisglycinate was as effective as the
Yeah.
standard dose of the, ferrous sulfate, and I'm forgetting that exact dose. I'll link that in the show notes, with the exact numbers there. But that's what I like to start with. So if possible, and if the person's open to it, starting with like a, beef organ supplement, because oftentimes that can, raise those levels, and then moving to an iron supplement, I would recommend, about 25 milligrams of the ferrous bisglycinate every other day, because we have that iron recycling in the body, so
Yeah.
that's about 48 hours. So, taking that dose every other day and keeping it away from calcium is what I typically recommend.
Okay. So I have a question. So I'm sure others will too. Beef organ. Tell me what
Yeah.
that is exactly.
Yeah, so short version, historically, people that were consuming animal foods would consume what they call nose to tail. So they were eating, all parts of the animal, not just the muscle protein. Whereas nowadays we tend to just eat the muscle protein, which is a great source of protein,
Oh,
don't get me
yeah.
wrong. But we're missing out on a lot of those really bioavailable vitamins and minerals that's found in those organ meats. So, like, know, also kind of, funny thing in my mind, if we look at, okay, what's the best source of, copper, vitamin A, or, iron, zinc, it's always like liver, liver, liver. Beef liver always flies one of the top choices. But like myself, I feel like most people don't consume those foods as a part of our diet.
Yeah.
So with the beef organ supplement, it's just freeze dried beef organs in a convenient little capsule. And you take,
Okay.
I think usually the serving size that's recommended is like 6 of the capsules daily, but, it's just a nice way to not have to eat the liver if you don't like the
Got,
liver.
got it. Great.
Mhm.
Um, so tell us now about prenatal supplements, just
Yeah.
regular. What would you advise? Have you looked into that? What ones are best? I usually go for the Nature Made. I tell everyone Nature Made's a good one.
Yeah.
but maybe there's better.
Yeah, so there's not in my opinion, there's not one that's like, "This is the ultimate best one. Everyone should be taking this." There are, multiple good options out there. So as far as prenatal vitamins, like I said, that's something that's pretty across the board recommended, primarily for the folate, because that's really important at, baby's brain development, preventing those neural tube defects. So it's recommended for a woman to be consuming about 600 micrograms daily of folate. So for a prenatal vitamin, we want to look for basically at least 400 micrograms. And that you'll see it's kind of confusing sometimes, but it'll say, 400 micrograms and in parentheses, 600, DFE, dietary folate equivalent. So basically anything over 400 is what we're looking for. And one thing to consider, so about half of the population has a gene variant, which makes it so that we can't methylate the folate or otherwise use, folate unless it's in its methylated form. So when we have supplements that are, kind of on the lower end of the spectrum, they tend to be folic acid, which is the synthetic form of folate, and so we can't actually utilize that in the body.
Ah,
So I like to recommend if you can find one, it'll usually say like L or L5 methylfolate. If we see the word methyl, you're good. That way, most people don't know if they have that gene variant. So just doing the methylated folate to make sure you can actually use it.
so
Um,
interesting. Yeah.
yeah, and most prenatals also have iron, so again, looking for that ferrous bisglycinate form if we can. That way we don't risk the constipation, and it's just more highly absorbable. And so there's one I can link to in the show notes. They tend, the higher quality ones tend to be a bit more pricey. So again, like don't break the bank. Just do what you can comfortably afford. I'll give one example. It's the brand is called Innate Response, and they have, kind of checks all the boxes, has like really highly bioavailable forms of those vitamins and minerals, and they're pretty in balance, which is nice.
Great. Yeah.
Yeah, and then one other thing I like to consider is omega-3 supplementation.
Uh-huh.
So both for baby's brain development and also, there was a recent article or recent research, article that came out this year actually showing that maternal omega-3 supplementation during pregnancy and lactation pretty significantly lowers the risk of, peanut and egg allergies in their offspring.
Cool.
Yeah, and I'll link to that, as well, but, we wanna be keep in mind that, omega-3s are great in general, but especially during pregnancy, we really want that DHA. So, EPA and DHA omega-3 are really only coming from, algae and fish. And so, if someone is, following a vegan diet, for example, um, algae supplement would be a good one there. So we get omega-3s from certain nuts and seeds like walnuts, flax seeds, chia seeds. Those are all wonderful for us. However, those are a different form of omega-3, ALA, omega-3. So we want that DHA also. Um,
Go
so
back there and tell me more about algae. Are we talking
yeah,
about seaweed?
uh-huh, yeah,
Yeah.
and so as far as like an omega-3 supplement from algae as well,
Yeah.
so if someone's comfortable taking fish oil, take the fish oil, it's easy, it's, readily available.
Yeah.
But for someone who is not comfortable taking a fish oil supplement, algae would be like an algae-based omega-3 supplement would be the
Yeah.
next best. That's where the fish are getting their omega-3s from, is from eating the algae.
Aha. Very
Yeah.
good. Okay. Um, you were talking about folate, folic acid, and I just wanted to backtrack on that a little bit. We advise our older moms, if you're over 35, and especially if you're over 40, to when you're planning a pregnancy, to start taking 4 milligrams of folic acid every day, which is a
Oh,
big dose. Um, and that helps to reduce uh, birth defects, neural tube defects, and brain disorders. So,
yeah.
um, and then of course, maybe keep taking it for the first month or so of pregnancy as well, and then go to. I think you said 600 micrograms, 4 to 600 micrograms.
Yeah, as a
Oh,
standard for
yeah,
standard pregnancies. Yeah, and I'm so
yeah,
glad you mentioned that as well. Mhm.
great. So interesting. I love all of this. I'm excited with all of this information. Uh, but to break it down for patients, um, so they were all the problems that could show up: the diabetes, the gallbladder, the bowel problems, sometimes anemia, and sometimes vomiting and nausea in early pregnancy. Can you think of any other problems that might show up in the pregnancy as far as nutrition is concerned?
Yeah, so one thing that you had, mentioned a bit before was so patients that have undergone bariatric surgery, like specifically gastric
Oh, thank
sleeve.
you. Yes,
Yeah, so
that's big. Yeah.
yeah, and kind of a
Huge here.
oh, yeah, yeah, and it's kind of a unique subset there. So,
Yeah.
um, now that I see lots of individual variations, pregnant and not, honestly, with people who have undergone gastric sleeve surgery. Some get to the point where they can eat almost their normal portion size than they did before surgery, whereas some are still pretty limited in the amount that they can consume. So, lots of, individualized, nutrition recommendations there, but really we wanna prioritize protein. So, for anyone who's undergone gastric sleeve surgery, I'm sure you probably remember early on in, your post-op period, it's protein, protein, protein. Because you're so limited in what you can consume, we wanna make sure that at least you're, saving that muscle mass by getting the protein in. So, same during pregnancy, we do, of course, wanna make sure we're getting carbs, for, ourself and also for, baby as well. It takes a lot of energy to grow a human. Um, but a little bit less emphasis on those non-starchy veggies because we don't wanna take up too much room in the stomach if we're limited in the stomach by those, fibrous foods, which are otherwise great for us, don't get me wrong, and we still want to incorporate those where we can, but that protein part of the plate is gonna be a bit larger for this population, depending on how limited they are in size, of the stomach.
When we think of women's health, people's health, two things, of course, pop up just in general population. Um, High BMI or obesity is a big deal. And then the other end of the spectrum, anorexia nervosa. So could you just maybe address that without the added pregnancy part, but just in general, could you talk us through a little bit of nutrition for those two parts of our population?
Definitely, yeah. So I guess kind of one at a time there. So on the obesity side of things, so I like to take very much a health at every size approach when I talk with my clients. So weight can sometimes be correlated with our health. Sometimes we'll have diabetes and we'll be in a larger body, but not always. So I have, definitely seen in practice, clients that are in smaller bodies that have, diabetes and high cholesterol off the charts. That their health is not in an optimal place. Whereas I have clients that are, in larger bodies and in, overweight or sometimes obese category on the BMI, but their blood work is great. So I think as far as like, I'm always looking at like those health parameters and what we can do to support, blood sugar control and metabolism and all those things. Regardless of weight, that's, health at every size, not meaning for anyone who is not as familiar with that paradigm, not to say that every size is healthy, but promoting health at every size. And with that being said, so when we're looking at, so again, like you said, not pregnancy related, but general population, if we're looking at, healthy, sustainable weight loss or weight management, those are the two core things that I'm looking at is supporting their metabolism. Cause I can say probably more than 9 times out of 10, the problem is not eating too much. It's often actually not eating enough or eating often enough, and the metabolism just slows way down. Or we see, indicators of like some early insulin resistance. And when we have that insulin resistance, that actually directly signals the body to store fat and impedes with muscle growth. So it's not to say that being in a larger body causes those health issues. It's often that those underlying, even low level health issues are contributing to the, the larger body size in some cases.
Say if I had a patient who was morbidly obese and I sent her to you,
Mhm.
um, how could you handle that? What would you do? Like she's thinking, do I need to go and have surgery? Could you help her? Is there something you would help her with? Would
Yeah,
you give her a diet to follow?
so we would work on all those core things. So definitely, nourishing the body, balancing meals and snacks, meal timing and frequency. There's a lot we didn't even talk about with that in relation to
Yeah.
metabolic health and,
Yeah.
when and how often we're eating in regard to that metabolic health. Um, but also, so at our practice, we take a holistic approach. So I know for the sake of this podcast, we're focusing on nutrition, which is great and super important. But during our appointments, like we often will also look at things like sleep and stress management
So
and
good.
fitness
Yes.
and all these other things that, absolutely contribute to our health and our body size as well. And so as far as the surgery that side of things, yeah, um I have definitely seen, everyone has different views on what is best for their body. And I always try to be as supportive as I possibly can. So I always explain to people, I will support you whether you do go with the surgery or you don't. I'm a big believer in informed decision making. So just making sure that that person has all the information to know, what to expect and kind of pros and cons of doing or not doing. Now it is kind of an interesting, again, very kind of specific subset, but I do have a client of mine who I've been seeing for a while who's in the place right now of, or I guess more recently has been in the place of trying to make that tough decision for herself of going ahead with this gastric sleeve surgery
Yeah. Uh-huh.
or not, considering she's looking to have her second pregnancy relatively soon. And she's a little bit uh, older age. So she's like, okay, I need to kind of make some decisions. And of course, it's a very, very individualized decision, very personal decision. The best thing that I can recommend in those cases is really having open communication with all providers on the team. So, endocrinologist, if there's an endocrinologist on board, midwife or OB, and really looking at, all parts of it. Because BMI, again, sometimes can come along with those other health issues like we talked about. But like in this client's case, it's not. And all of her blood work is fine and great. And she actually has a baby right now. And that pregnancy went well. The baby's healthy. So just weighing all the pros and cons and saying, okay, is it is it likely better for me to be potentially more nourished in a larger body or potentially less nourished in a smaller body as far as getting the surgery versus not and timeline of pregnancy, like, there's so many things to
So
consider.
much. Yeah.
Yeah,
Yeah,
and
and
it's
I
exciting.
like that you look at it holistically, and
Mhm.
perhaps we could even add in a psychiatrist if needed, or
Oh, yeah.
yeah,
Mhm.
some form of therapy. Yeah, I
Right.
have a really great nurse practitioner, mental health nurse practitioner that I send my patients to, and she always starts with what are they lacking in nutrition,
Yeah,
and she start them on some supplements as well as
of course.
medication if they need it.
Love that.
Wonderful. I love it too. So then, on the other end of the scale, what about somebody who might suffer from anorexia? I have patients with this problem too.
Absolutely, yeah, so that could be a whole other podcast. The
Yes.
I'd say
And we
the
can do one. We could do one if you want.
yeah, I mean, so that like, all honesty, I'm
Yeah.
very I try to be very clear about, what I feel comfortable handling and what I don't,
Yeah.
and quite honestly, like,
Yeah.
in our general training as dietitians, eating disorders is not something we have much training
Oh,
in. And
right.
so,
Yes.
like at our practice, we're fortunate to have a dietitian who almost exclusively sees eating disorders, and that is her
Yeah.
specialty.
Yeah.
So, I see, I see a lot of clients that have disordered eating patterns, absolutely. But for someone with, full-blown anorexia nervosa that they're actively engaging in that eating disorder, I always send them over to her so that she can give
Yeah.
them that extra level of care. So for that, especially for the pregnant population that's struggling with any sort of eating disorder, especially anorexia, I would highly recommend seeing both a therapist who is, well trained in eating disorders, because again, it's a
Yeah.
niche thing, and then also a registered dietitian who specializes in eating disorders to make sure that not only we're helping that person with their mental health in a time where, my gosh, your body's changing and you can't really do anything about it. And for someone who's struggling with body dysmorphia, I can only imagine how difficult that
So
must be.
hard, so hard. Yeah.
And so the
Yeah.
mental side of it, and then as far as, an RD who's trained in that, just to make sure that they're as best as possible meeting their body's needs during that time too.
Mm. So wonderful. Well, we could talk all day, couldn't we? There's so many interesting things we just touched on. Um, and if we need to revisit, perhaps you'd come back and talk about specific, maybe something that you're interested in. Is there one subject that you're particularly interested in?
Oh. Um, oh my gosh. I mean, I feel like there's many, but yeah, definitely pregnancy and lactation.
Lactation. Yeah.
Lactation, yeah, which, I mean, super short, just to throw that out, like really same basics as,
Yeah.
as prenatal. However, so, like, in pregnancy, for example, no, I don't like to focus on calories and, people may have noticed I haven't talked about calories in this
Yeah.
conversation, and that's because calories don't tell us anything about the nutritional, quality of what we're eating and, what we're actually getting from our foods, but with that being said, our caloric needs are actually a bit higher during lactation than they are in pregnancy, so, all the same things, still actually continuing that prenatal vitamin during lactation since your needs are, you know, continued. You're still, providing the nourishment for that baby. There's nuances there as far as, are you exclusively nursing or pumping? Are you supplementing with formula? Things like that that we would want to look at. Um, but yeah, and certain kind of nuances as well. Like, um, I'm sorry, there were things that we kind of skipped over as well, but super quick, like caffeine, for example, is something that we want to limit in both pregnancy and lactation to about
Ah,
200 milligrams or so per day. And then alcohol, that's where it gets a little bit different. So alcohol, it's recommended to avoid during pregnancy because you're never drinking alone when you're pregnant. That fetus is always getting, what's going into your body. But with lactation, it is it is known to be safe to have, 1 standard drink, so that would be 5 ounces of wine, 12 ounces of beer, an ounce and a half of hard liquor, as long as you're waiting 2 hours before nursing or pumping. Um,
okay.
yeah, those are kind I know there's so much we could talk about, but
It's so interesting because we need food, don't we? We need nutrition. So I think your job is so very important. Um, I tell women, that they're not eating for two. They're breathing for two, sure, but they're not eating for two. That just to add like 350 calories maybe in that second trimester, and maybe a little more in the third trimester, 450. And that's a small amount of food, really. I just ate 2 cookies out there with my cup of coffee, and that was 500 calories. It's like,
yeah,
but I feel bad for women because maybe not as active. Some women are not as active in pregnancy, a and they're hungry, and then there's that psychological part of, like, "I'm eating for 2, I can have these french fries and the cookie," and,
yeah.
we don't want you to do that. We want you to be very careful, because even though the lactating, part, if you're breastfeeding, you probably will lose weight quickly, and a lot of the extra adipose tissue on your body is gonna go into making breast milk. Um,
Mhm.
and, yeah, you'll need more calories, right? How many extra calories would you think when you're lactating?
Yeah, so full disclosure, the general recommendation is 500 extra calories per day, but oh
Yeah.
my gosh, I think that's just it's so general in my opinion, 'cause I can tell you when I had my daughter, I was never hungrier in my life except for that first 3 weeks after I gave birth to her.
Yeah.
I mean, having, in my case, it was a 24-hour labor, 3 hours of pushing,
Yes.
And then, of course, as you're losing some amount of blood, it's taxing on the body. I mean, it's amazing. Childbirth is amazing, absolutely. But it's a lot. And so I ate, I can tell you, way more than 500 extra calories per day in that beginning because I was listening to my body, and my body needed more than that.
That's
Um,
so interesting. I love that.
yeah. And really, so both pregnancy and lactation, the reason, I mean, you're absolutely right, and that's what's generally recommended, like 340, 350 extra calories, pregnancy, a little bit more towards the end of pregnancy, and then about 500 in breastfeeding are the general recommendations. But just like when you're in pregnancy and for any pregnant moms out there who, follow the What to Expect, all those different apps where it tells you what's happening with baby week by week, you'll see that baby's growth is not linear. So it's not that they're growing exactly the same amount throughout the whole pregnancy.
Yeah.
And so something that we also, really focus on, in individual sessions is the intuitive eating principles. So, like listening to hunger, fullness signals and kind of how different foods feel in the body and things like that. And if we can get to a place like that, it's so, so valuable because, a lot of women will even find, wow, this particular day I was craving more carbs or I was craving more protein or yeah, I was a little hungrier
Yeah.
this day than others. And it really can reflect the baby's growth, just like we know as with
Right.
kids too. They tend to crave carbs before a growth spurt, and they tend to crave protein after a growth spurt, and their needs are not linear either. So, I like to
Right.
keep that kind of general and
And
just,
they'll even have those growth spurts while they're breastfeeding, and they'll get extra hungry, and that's sometimes during those times women think, "Oh, I'm not making enough milk. Now I am
Mhm.
going to give up breastfeeding because my baby is not satisfied." But they're just going through a little growth spurt.
Oh, yeah, and even
Yeah.
just baby to baby. My daughter was a really frequent nurser, and I
Yeah.
would have friends with babies the same age, and they were nursing, less often, but more at a time, and my daughter was less at a time more often, and there's so much
So
individuality.
many variables because we're all just human beings, just trying to
Mhm.
figure it out. Yeah. But
Yeah.
let me tell you, you helped us figure out a lot here today.
I
Brittany,
hope so.
thank you. This is so interesting. And I'm pretty sure we need to do it again on some other subject, or if you have the urge to tell us more about anything, please, we'd love to have you back.
Yeah, I'm
Come back.
so appreciative of you having me here, so thank you for it. Because yeah, definitely something I'm passionate about and, like we've said multiple times, oh my gosh, we could go on forever about this topic. I hope that was at least a little once over. It's
So
true.
great. So, if anybody listening to this is looking for a nutritionist, we're going to look for Brittany Fowler. And what is the name of the place where you work, Brittany?
Yeah, our practice is 360 Nutrition Consulting, in Camarillo. Now we do see clients internationally. I have clients on the East Coast because we have video appointments available as well. So, um, yeah, all of our clinicians have video capabilities. Some of us are hybrid as well. So like I see both in person and video clients. Yeah, and anyone that's interested, I would be happy to see you.
360 Nutrition Consulting in Camarillo, California. And she can see you online or in person or both. What about insurance? You accept insurance?
We
All
do. We
sorts of
accept,
insurance.
yeah, most major insurance carriers. All that information is actually on our website, which I'll make sure is in the show notes. And we also have information on our website on how to verify your specific insurance benefits. So, we take most insurances out there, but your specific benefits based on your plan can vary. So we have, questions to ask your insurance, like, is it covered in your preventative benefits? Is there a limit on visits? Is telehealth covered? And you can give them some codes from our website as well.
Fantastic. And I have another population I'm going to start sending to you as well, and that's the older women and girls and people that I see. Um, because, of course, we worry about our bones and, hormones and our wrinkles and hair getting dry. And, you know, um, our patients in menopause, they ask us all sorts of questions about nutrition. And I think that you're probably the person to talk to them. So I'm going to send them your way. It's going to be pregnancy and menopause.
Oh, no, that's wonderful. Yeah, and that's something that could certainly be a whole other podcast of, a whole other topic and something that's just not as talked about as it should be.
Well, thank you, Brittany. This was wonderful.
Okay, thank you so much, Sally.
Great. And thank you for listening to the Bleeding Truth podcast. We learned some good truths about nutrition here today with Brittany Fowler, and hope to see you again soon. Thanks a million. So thanks again for listening. We really appreciate it. And if you like what we're doing, give us a bit of a review on Apple. That would help us so much. And if you come across a subscribe button, press the subscribe button. It doesn't cost you anything.